whether you need to rub it on your head, whether you need to inhale it, because all these forms can be used for headaches. You understand? So it is important.
Or just swallow it.
Or maybe you just drink it. That's right. So it is important that you sit down and listen to what the pharmacist have to tell you. When the pharmacist said, okay, I'm going to ask you a few questions, just give me your basic information. Don't get upset about it, because the pharmacy does not want the information to store for their own purposes. However, if something goes wrong, if afterwards the pharmacist might have realized, okay, we made an error, we have your contact information. We can call you and let you know that this is what happened. Can you come back to the pharmacy? If we don't have that information and you step out of the pharmacy, you go home and you take the medication, something happens. That's terrible. So just allow at least 5 minutes to get some questions and answers with the pharmacist. Let the pharmacist create that profile so we know exactly what we're doing, preventing any drug-drug interactions, which is very, very common. You understand? So I want to say again, do not rush your pharmacist. Please, for your own benefits, for your own safety.
I mean, look at it. You can't put milk and juice together.
You can't put oil and water. Oil and water does not mix either.
You know, so certain medications will not go with each other.
Some of the other things that the pharmacist would do, as you ask me, is that I want to remind you that the pharmacist is also one of your healthcare providers. Do not look at us again as pill counters. We are one of your healthcare providers. So we have access to your physician, we have access to your nurses. And if I get a script and I'm not clear about it, I will call your doctor. That, again, is one of the reasons why the scripts are not just feels like pulling something on the shelf and giving it to you. If I notice that something is questionable on the prescription, I will call the doctor. I may have to wait for the doctor because he might be seeing somebody at the time and cannot answer the phone, or the telephone might be busy. Do not get upset, because we're trying to give you the best treatment. Right medication, right person, right time, right drug.
Don't you think it's because people have that perception about the pharmacist that the doctor takes care of me, the nurse takes care of me, the pharmacist just there to give me medication?
That is very true. And that's very interesting that you say that. It is very true, because we're not the primary care contact patient. Mm. I mean, patient and care provider. We're in the background. Because, for example, well, in Dominica, it's a little bit different. In the Caribbean region, it's a little bit different. But if you go up to North America and the UK and those places, almost every pharmacy, if you go in the hospital, is in the basement. You understand? And so we always make fun about it, because everybody else have the direct contact with the patient, but we don't. But what we do is critical to your care, to you getting better. So don't see us as the last and not important in the betterment of your health, in you getting better, in you being safe. We're critical in that area.
And that's what this program is trying to do. Make people understand the importance of managing your medication.
Yes.
And your pharmacy is a vital part.
Vital part. Mm-hmm. The doctors, the nurses, yes, they are, because they have one-on-one rapport with you. They touch you, they see you, they feel you. We just put the stuff together, but we make sure what they're asking for is right. Because, like I've said before, there are so many different manufacturing companies out there. There are hundreds and hundreds and hundreds and hundreds of drugs on the outside that some of the doctors are not aware that they're there. They come in different forms, they come in different formulations, they come in different packaging. And so when you go to the pharmacy, you will tell the pharmacist, oh, my doctor said this, my doctor said that. Yes, I respect that. But at this point, the medication is being dispensed to you. If the doctor asks you for, let's say, for example, a 250 milligrams something, and you cannot get the 250 milligrams, we're going to have to find a way to get you 250 milligrams. So we may take a 500 milligram and change it to 250, give you the appropriate amount that you need, or we may take a 125 and give you 2. If it's a liquid, we have to calculate it. You understand? So all of that is important. We are there to make you better. So we want you to understand that the role of the pharmacist is critical in health care. It is critical. We are not pill counters. Those were the days they called the apprenticeship system, where based on your experiences, what you give out, you just assume, you just mix things together. They were very effective, I'm not saying no. Mm-hmm. But today, the role of the pharmacist has emerged much higher than that. The pharmacist, depending on the level of the degree qualification, they actually work alongside with doctors, recommending to the doctors what is the better cure for this patient. Even if you're hypertensive and I am hypertensive, the treatment options for both of us is different. Mm-hmm. The pharmacist is the expert at telling the doctor which would be a better treatment. You understand? So that is how pharmacy has evolved. So we're not pill counters, we're not dispensers.
And just have to give MB powder for your boo-boo.
Yes, and even
had a boo-boo before.
yes, and even if we had to give you the MB powder, we still had to make sure that you use a right amount of the MB powder. It's not just throwing the MB powder on your foot. You understand? So even that seems simple, but it is also critical.
Ladies and gentlemen, we're talking tablets and spoonfuls on your radio. We'll be right back after a word from our sponsor, Quick Cure Pharmacy.
And as sorti Dr. Kuti has with him, we number 1, Mali PS Biology and Letemamo. It is a eulogy. It is number 2, Pametemo Asu Ice, Mohani of Widi. Mawidi, that is Sotu Kapariano. Speak life, man. They mene Alida Kuti, Quick Cure Pharmacy. Like one trailer, see what this year and you have 72 hours of sleep. Because everything about Quick Cure Pharmacy speaks of life. Plastani Bell, clean, spacious plants, different list of your medicament pack, the air condition. Oh, see what it's your oasis in a desert land. You just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Cure Pharmacy has browser after your blood pressure and sugar check one time and get your top up too. And I do you put 20 on my cell phone. And of course, over the counter drugs and prescription drugs. Appresently, and I do money white here. Go to Quick Cure Pharmacy. The outlook on life has changed. If you buy any buy medicine, may you pally buy him. Actually, make a exercise to live on my tank and leave him away. Get up, lazy Harry. Harry him to Jukadi elastic away from last himself. The last shall be the first, Harry. Move that body, Harry. Quick Cure Pharmacy are over Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4.
Okay, ladies and gentlemen, welcome back to Tablets and Spoonfuls on your radio. We're talking about a relationship between the patient and the pharmacist, and it is so critical, so important. Tell me some of the stories, some of the things that you actually go through. I'm sure things happen, you have experiences, the kind of experiences you have as a pharmacist in dealing with patients.
I mean, it's countless. It's countless. You have people come in and say, but how long is it taking to conk some pills? You know, imagine how long it taking to conk some pills. All the people slow, you know what I mean? All you have to do is conk the pill and put a sticker on it. And they will say, is it the yellow one? Because they had the medication somewhere before, so they come with a prescription that the doctor gave them, and they suspect it might be the same drug that the doctor gave them. Is it the yellow one? I don't know if it's the yellow one. You understand? I mean, this is not the way. It's something that you're going to put into your body. It's important. You might have gotten it yellow before. It could be green now. But even if he gave you a yellow before, you say it didn't work for you, did you take it the way that he wanted you to take it? So we have all those approaches and attitude toward their medication, towards their treatment.
Even abuse sometimes?
And abuse, you get abuse all the time. All the time. You know, but I've been in the profession, like I say, from a very long time, right after school, and that's all I've been doing. I have interacted with all different cultures outside of Dominica, because I've worked longer in pharmacy outside of Dominica than in Dominica. So I have had experiences with a wide range of different cultures. So the abuse is just like, you know,
was on a dashing leaf.
Yes. If I could show you some videos on abuse, you know, the pharmacists get all the time. It's not.
Because people come there, they're frustrated sometimes.
Yes, they come.
Maybe they just discover they have an illness, some sick, incurable disease or something, and they want to pass. You're the last person they see, and they want to pass it on you.
Yes, but we're there to help you. We're not there to look down on you. Don't feel ashamed because of you coming for medication for A, B, C, whatever. We're here to help you and we're here to serve you. So try and at least trust us and allow us to take care of you by not rushing us.
And of course, people seek information on the internet and then they come to you like they are little pharmacists themselves and they think you know much better than you sometimes.
Yeah, not even me. I mean, even the doctor, because the internet puts a large amount of health and wellness information at our fingertips. But if the information is outdated, incorrect, or downright dangerous, it causes more harm than good. You need to be able to rate the information you find. And some of the ways that you can do that, you have to look at the website. When you go on the website, you have to know who are the sponsors, who sponsor the site. Okay? If there is no sponsor, forget it. Just ignore it.
Why?
Because anybody can go online and create something. Anybody can create a website. And on the website, based on their own experiences or whatever, they can just, or their understanding, they go and they put things. And some people maliciously do things that they shouldn't do. You understand? So we cannot take the internet at face. We have to take it at face value. On that same website, if you don't see a sponsor, click and see what it says about us, meaning the site. There you can see if it's somebody that is credible, you know, so you can, and genuine, so you can decide that based on that, If the information is dated, check and see when it was last updated, the copyright date. That will ensure you to see how relevant that site is, because that could have been something written in 1980 something, and now we have new information. Mm-hmm. So you need to check on that. The websites sometimes offer a clear privacy policy. Those are genuine sites, a clear privacy policy. And so sometimes they ask you for feedbacks. You know, those are the websites that are more credible, that you just don't go Googling any health issue, because you're likely to find something that is unmanageable. And that's just the nature of the internet. So you don't want to do that. The website should not replace your doctor. The website should not replace your doctor. Only you and your doctor can decide what is best for your health.
Not Dr. Webb.
Not Dr. Webb. That's very important. It is important that your doctor be recognized and your doctor be first. Because a lot of people diagnose themselves from the internet. I mean, some people go and they get some credible sites, yes, and they might have some symptoms and so on, go and discuss it with their doctor and find out. This happens.
It's good to know.
Yes, it's good to know.
Get information.
Yes.
But then with symptoms, they present themselves like different diseases, but the same symptoms.
Yes, especially
it can be confusing.
Yes. It's very, 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 very confusing.
Makes you think you have a cancer or something when it's not some simple thing you have.
That is so true. That is why you should not have the website take the place of your doctor and discussions with your doctor. It is important. So we want to encourage you that you use this information and find it trustworthy before you make a decision. Because some people will come and they'll say, oh, I Googled that on the internet and it says this, it says that. There's a reason why there are some side effects that are not discussed, because it is maybe a 1% or 2% of the population that might get that. It is not a serious side effect. It's something that you probably will monitor, but it's not a serious side effect. So we don't go giving you all the side effects of a drug.
Get more scared than anything.
So when you go online and you see that, oh, I saw the side effects in there. Yes, it's true. It is in the information for the experts to deal with, not you as the patient.
And you know, in America, for example, they will advertise a product, and at the same time, they must give you all the side effects.
Because the FDA approved that because of that suing issue. Mm-hmm. But those side effects are the critical side effects. It is not just the normal nauseated stomach, a slight dizziness. You know, something that's more serious. If you're a cancer patient or if you're a diabetic, that they will let you know that you're not supposed to use it if you're a cancer patient. If you had chemotherapy before, or if you're a diabetic, you're not supposed to use it because it can elevate your sugar. A minimum amount can do that. So it is important that that information is out there to you. But the information that it might give you, Ray's syndrome or Johnson-Hopkins syndrome, these are rare cases that if you come to the pharmacist is not going to tell you that. You understand? However, it is important that you should not go and diagnose yourself on the internet. If you see something that is questionable and you're curious about it, speak to your doctor about it.
A farmer is a farmer. A fisherman is a fisherman. A doctor is a doctor. A pharmacist is a pharmacist. You can be a farmer and a pharmacist. Well, you can.
Yes, you can. Yes.
But if you're a farmer, stick to farming.
Stick to farming.
Let the pharmacist deal with medication, with tablets, spoonfuls.
I agree.
Once again, it's nice being on your radio. Ladies and gentlemen, you can call for more information, for clarification. You have a question, a comment, call. The number to call is
440-8600.
Right, 440-8600. And of course, we'll do our best to help. Listen again next time for another program called Tablets and Spoonfuls on your radio. Till that time, I'm Felix Anderson.
And I'm Martha Augustus.
Take care now. Bye.
Bye-bye.
Take care of yourself. Manage your medication properly.
Yes, and do not rush your pharmacist. That's right.
Tablets and spoonfuls. Tablets and spoonfuls. How to manage your body, taking medication while at home. Correctly taking your meds will help your system. Tablets and spoonfuls for surviving care pharmacy. Tablets and spoonfuls for surviving care pharmacy. Tablets and spoonfuls.